Hello everyone, I'm Dr. Sean, a sports orthopedic surgeon dedicated to helping you move freely and comfortably. Today, I want to share some exciting advancements in treating cartilage injuries, specifically autologous chondrocyte implantation, and how it can make a significant difference to your recovery. You might be wondering, why is cartilage so difficult to heal? Well, cartilage lacks its own blood supply, which means it doesn't receive the nutrients it needs to repair itself effectively. Traditional methods like microfracture surgery involve creating tiny holes in the bone to simulate a healing response. While this can help, the new cartilage form is often weaker and less durable. In the past, we also had the option of harvesting your cartilage cells and growing them in a lab over several weeks, a process called autologous chondrocyte implantation. While effective, it requires multiple surgeries and a lengthy waiting time. But here's the exciting news. Modern single-step procedures are revolutionizing the way that we treat cartilage injuries. During surgery, we can now harvest a small amount of your healthy cartilage and process it right there in the operating room. We create a personalized, cell-rich graft that we can then implant immediately into the damaged area. What does this mean for you? It means a more efficient surgery, reducing healing time, and potential for stronger, more durable cartilage repair. These modern methods combine the benefits of using your own cells with the convenience of a single procedure. Imagine getting back to your favorite activities sooner, with less downtime, and a more robust recovery. Isn't that an outcome we all love to achieve? While this technology is promising, it's important to note that it's relatively new, and ongoing research is helping us understand its long-term effectiveness. However, early results are encouraging, and many patients are experiencing positive outcomes. Recovery time varies depending on the individual, but many patients start rehabilitation soon after the surgery and progress steadily under guided care. With dedication to your recovery plan, you could be back on your regular activities faster than with traditional methods. If you have been dealing with cartilage injuries or knee pain, now is an excellent time to explore your options. Taking action today can set you on the path to improve mobility and a better quality of life. Your journey to better movement starts today.